In this video, I'm going to talk about another one of the more common overuse injuries in Kendo, plantar fasciitis. Before we get started, a quick disclaimer. I'm not a doctor and this shouldn't be construed as medical advice. The information here comes from my own experience with Kendo and with plantar fasciitis. Also, in my day job, I'm a journalist and I covered science and medicine for several years, and I have an ongoing interest in sports medicine, both in theory and in practice. The plantar fascia is the connective tissue that covers the muscles and tendons that run along the bottom of the foot. Plantar fasciitis, or PF, is the inflammation of that tissue, which can cause pain or soreness. Among Kendo practitioners, it seems to be more common in the left foot, probably because if you're in Shudan no Kamae, you're pushing off with the left foot. But I've also seen Kendo practitioners with PF in the right foot. My own bout of PF occurred in my left foot after I did a pretty intense round of plyometrics, which probably added to the stress from Kendo, and it took months to completely heal. The classic symptom of PF is shooting pain on the bottom of the foot, in the heel in particular, especially when you take that first step out of bed in the morning, and that soreness tends to ease as the day goes on. If the pain is severe, you should of course go see a doctor that specializes in sports medicine. A family doctor will probably tell you to stop the activity that's causing you issues. In one sense, that's perfectly reasonable, since rest is the first line of defense against a repetitive stress injury. But if that's all the advice that they give you, then, in my opinion, as an athlete, that's not an acceptable answer. You need to find a solution to heal the injury so that you can continue the activity that you love to do. There are common mistakes in dealing with PF that even a lot of medical professionals aren't quite up to date on. One is the notion that you have to stretch the plantar fascia. The results are very mixed in terms of stretching as a way to deal with an injured tendon or fascia, whether it's the Achilles or the plantar fascia, especially when you're talking about a long-term solution. One of the remedies recommended for PF is a night splint that puts the foot in dorsiflexion. This is dorsiflexion, and this is plantar flexion. And despite its widespread use, studies have shown that it's not very effective in treating PF, especially in the long term. There's a 1999 study that looked at how effective a night splint was in treating PF. This was a prospective randomized clinical trial, which is the gold standard when it comes to studying medical treatments. That means you find a bunch of people suffering from PF and you randomly divide them into two groups. One group gets the treatment while the other serves as the control group, and then you see how well the treatment works compared to the control group. The result? No statistical difference between the two groups. I'll put a link to the abstract of that study in the description below. There's also a 2007 study, about 1/4 the sample size of the 1999 study, that found an improvement in heel pain in the short term when using a night splint, but no significant effect or prevention of reoccurrence in the long term. I'll put a link to the abstract of that study in the description below as well. The upshot is this: a night splint may relieve pain in the short term, but it's not effective at actually treating the problem in the long term. These studies also offer an insight into why stretching exercises you sometimes see recommended for treating PF, such as pushing your toes up against the wall, don't seem to work very well. Another common mistake in treating PF is icing the bottom of the foot. Icing after practice may relieve some of the pain temporarily, but as I mentioned in the tennis elbow video, there's a growing body of evidence that suggests icing may prolong the time it takes to heal a chronic injury. Inflammation is the body's natural mechanism to deal with injuries, and studies suggest that if you keep icing the region to prevent the inflammatory response, it can be counterproductive. Another option, if you have a mild case, is taking a non-steroidal anti-inflammatory drug, an NSAID like ibuprofen, consistently. But make sure you don't take NSAIDs on an empty stomach, because there's a real danger of gastrointestinal bleeding. More than 100,000 people go to the hospital every year in the United States due to serious cases of gastrointestinal bleeding from NSAIDs. In my case, the PF never got to the point where I needed a shot of cortisone or corticosteroids, but that is one of the treatment options. Used under the right conditions, a cortisone shot can work wonders, but it also has some side effects that you have to be cautious about. The most important and potentially dangerous side effect is that a corticosteroid can weaken a tendon, making it more prone to injury. That's why doctors recommend not getting multiple cortisone shots in one location. There's been some very interesting research in the last decade or so on treating chronic injuries in tendons, ligaments, and fascia. The big picture that has emerged is twofold. One is that you need to strengthen the supporting muscles and structures surrounding the injury, and two is that you need to realign the collagen fibers in the injured region, not elongate them by stretching. So how do you realign the collagen fibers? As I mentioned in the tennis elbow video, one way to do it is to load the tendon on the lengthening motion, also called the eccentric motion. Another way is to massage the fibers using methods such as augmented soft tissue mobilization, or ASTM, which basically massages the region parallel to the muscle fibers to break up scar tissue and realign the fibers. I'll put a link to a video in the description below on augmented soft tissue mobilization. One way to perform self-massage is to use a golf ball or lacrosse ball on the bottom of your foot, and I would recommend using a foam roller on your calves as well. For me, what finally worked after trying all kinds of different things was yoga. One of the reasons I think yoga worked for me was because it deals with the entire posterior kinetic chain, that is, the plantar fascia, the Achilles, the calf muscles, the hamstrings, the glutes, and even the lower back. It's been my experience, not only with PF but with other overuse injuries, that dealing with the injury in isolation doesn't work because one part of the body is intricately connected to other parts of the body. An injury may appear in one part of the body, but the root cause of that injury may actually be in another part of the body. A classic example of this is knee pain among runners. Even though the knee is where you may feel the pain, the root cause of the problem is not the knee itself. For many runners, the solution is often strengthening the muscles around the hip and learning how to activate the gluteus medius. That's why you may want to engage in some general weight training routine. An overuse injury is often the result of an imbalance, where one part of the body is overcompensating for a weakness in another. I'll put a link in the description below to a video I made about strength training for Kendo and Iaido. I think the most important takeaway is to take a more holistic view about how to treat an injury like plantar fasciitis. It really pays to keep in mind that where you feel the pain isn't necessarily the root cause of the pain. And if you want to have longevity in Kendo, as in any intense physical activity, you need to know when you can push through the pain and when to take it easy. So please train smart.